Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi, everybody. Tom Viola from Pharmacology Declassified. We get another Fast Facts Pharmacology Edition. Well, we're moving on in our topic of cannabis, my friends, and we want to talk more about the dental considerations that you, the dental professional, would have to make when it comes to your patients who may be using cannabis. Your patient walks in, sits in your chair, and says, "Guess what? I used cannabis recently, within the last 15 minutes, because I wanted to take the edge off, because I'm nervous when I come to see you." Okay, well, what do you know about cannabis? Well, we do know from things like the ADA oral health topics that cannabis can cause both immediate effects like cognitive and psychomotor impairment, but also some chronic effects, things like addiction and even psychoses. Now, I must say, this is something that is relatively new. The ADA has put out some information on this that is second to none when it comes to informing dental professionals about the effects of cannabis, both on the patient's systemic health and their oral health. But keep in mind that some things may escape our attention. And that is, for example, how many of you in this audience knew that cannabis use raises your blood pressure and pulse? What? How could that be? It's supposed to mellow you out. It's supposed to calm you down. That's true, but it does raise your blood pressure and pulse, and that may increase the risk of things like stroke and heart attack, especially if we're using drugs like epinephrine, which can also raise blood pressure and pulse, right? In addition, cannabis can cause immunosuppression, as we said in our last episode, which increases the risk of opportunistic infection. So, those two things alone are pretty troublesome for folks in dentistry. But what I'm really concerned about here is this increased risk of myocardial infarction and stroke, and also the potential for cognitive and psychomotor impairment. It leaves us open to some ethical issues as well. If your patient admits to using cannabis 15 minutes ago in the parking lot, does that mean they're impaired and can't give you informed consent for a treatment plan? In addition to that, what if you're the cannabis user, right? You work in an industry that's fraught with repetitive motion injuries, shoulder, neck, wrist. So you might be the perfect candidate for a drug like cannabis to treat chronic pain. But if you were to use cannabis while you were working, or, in between times you're working where it may have a latent effect, would you therefore be practicing while you're impaired? Would you be open to liability, perhaps even malpractice? So these are the things that we worry about when it comes to cannabis use, because again, there's just a lot we don't know about cannabis, and more research is coming. So in the meantime, my friends, stuff for you to ponder, and I hope you get some sleep tonight, because obviously these are things that are concerning, but we really won't know the answers for some time. This is Tom Viola from Pharmacology Declassified signing off, saying, be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products, from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.